I am Jang Jishim from Ulsan University. This is the first lecture on community infection control. We will find out prevention rules including safe drinking water, sanitation, and hygiene. The required service of a healthy community includes safe drinking water, environmental control of hygiene, and personal hygiene. The WHO calls these three factors WASH. First, let's find out the international statistics of WASH. About 660 million people worldwide lack access to safe drinking water. 1.9 billion people are known to drink water contaminated by feces. Unmanaged drinking water may be contaminated by microorganisms due to various excrements. Therefore, it is advised to be careful to avoid contamination by microorganisms when the drinking water is collected, transported, and stored. In terms of environmental control of hygiene, a third of the world's population does not have access to improved facilities. About 13% of the population relieve themselves in the open space. South Sahara in Africa and South Asia has the highest rate of insufficient environmental control of hygiene. Regarding personal hygiene, it is crucial to wash hands, since washing hands are a personal behavior so that it is not easy to grasp the international status. However, there are data to research the frequency of washing hands or the status of washing hands by using soap. In 2014, observation research in about 19 countries reported that only 90% of the population performed washing hands when they reached contact with urine and feces. From now on, we will grasp about intervention methods to improve WASH. First, there are methods to improve personal hygiene. The most important element of personal hygiene is to wash hands. When it is necessary to wash hands, you must wash hands. It is also important to wash hands correctly. Due to the ongoing global pandemic lately, it is emphasized to washing hands a lot. However, the rate of daily practice is still insufficient. It is recommended to use soap and the appropriate amount of running water. Wash the hands for 40 to 60 seconds, or to use the alcohol agent used without water and rub the hands for 20 to 30 seconds. Unless you wash your hands correctly, a large number of germs will stay in your hands. The diagram shows the parts that are not cleaned generally when people don't wash their hands correctly. The parts that are not cleaned well are marked red, which are some parts of the palm, the fingertips, thumbs, and the tip of fingernails. Here are the parts that are not cleaned often. They are marked yellow. The blue presents parts that are cleaned well generally. Therefore, it is crucial to apply the 6 steps of washing hands correctly every time. It is essential to provide proper facilities to encourage to wash hands. Articles and facilities must be equipped. It is required to prepare soap, water, alcohol agents in homes, schools, medical institutions, and public places. And it will be useful if a simple hand wash station is equipped in the area where the food is prepared. The WHO informs people of how to manufacture alcohol-based hand sanitizer by themselves. This will be useful for the underdeveloped countries or regions where alcohol hand sanitizers are not supplied properly to make alcohol hand sanitizers at an affordable cost. The second method of personal hygiene is food management. The WHO suggests 5 key elements for safe food management. The first key element is to keep the area of handling the food clean. Wash tableware and the kitchen counter, and protect from pests and animals. The second is to handle foods by distinguishing raw food and cooked food. When cooking foods, they should be heated enough up to 70 degrees so that people can eat foods safely. When storing foods, a proper temperature is crucial. When storing foods, keep them at room temperature only for 2 hours or less. When storing in the refrigerator, keep the temperature below 5 degrees. Lastly, use safe water and food ingredients. The next is the environmental control of personal hygiene. Animals should be prohibited in areas where food is being prepared and served, and feces of animals and children should be removed regularly. Disease carriers such as flies, mosquitoes, cockroaches, and rats must be controlled. It includes preparing the drains and discharging wastes properly. Since toilets, basins, kitchen floors, and other surfaces are easily contaminated, Wash them with soap and water often. Disinfect them with household bleach if possible. It is necessary to regularly clean up the area where children are playing. For example, plastic mats that are easily washable are provided and effectively used in Zimbabwe. What should be put first in terms of environmental control of hygiene is to safely discard human urine and feces properly to prevent contamination in the environment and provide facilities and services for it. A facility is needed to hygienically separate wastes from human contact. This facility can be prepared with pipe sewerage systems, septic tanks or pits, pit bathrooms with improved ventilation, plus compost bathrooms for pit bathrooms with slabs. This diagram is from the source book of the WHO and UNICEF, showing the process to treat human feces. Examples of improved facilities are introduced toward the right side. The third intervention for WASH improvement is drinking water management. People need 15 to 20 liters of water per day. Water is used mainly for drinking, preparing food, cleaning, washing, and personal hygiene. To use the water safely, the water must be supplied through pipes or public standpipes, public taps, well-protected dug wells, protected springs, and rainwater. However, it might take a long time to prepare these facilities on a large scale. So, homes, schools, and medical organizations, which are at the point of use, should prepare safe drinking water since they use water directly. To prepare safe drinking water, it must be disinfected to remove pathogenic microorganisms. It is also necessary to safely store the water. For example, there is sporidium that may exist in the water not disinfected. There are protozoan microorganisms called small cryptosporidium. If someone is infected by these microorganisms, people with HIV who have a reduced immune mechanism may be led to diarrheal disease, which is a fatal infection. It is a homepage run by WHO to introduce how to handle and safely store water in the household. Various methods of handling water are suggested. Each photo shows how to disinfect by using chlorine, to disinfect drinking water by using powder, to use sunlight and disinfect by putting the drinking water into a transparent bottle, to filter microorganisms by using fine stoma in ceramics, and to filter harmful microorganisms by using sand. To prevent the recontamination of treated water like this, it is also important to put water in the container with a top and keep them in a safe place. I explained personal hygiene, environmental control of hygiene, and the method of managing water safety. Thank you for listening.